The title of this episode is a little shocking, but let me ask you something. If your loved one's life was on the line, if they were in the operating room or waiting to be administered drugs to save their life, would you trust a machine over a human to make that decision? I'm Spencer Scott, and welcome to this episode of Quantum Logic. Today, we're diving into how artificial intelligence is already embedding itself into every part of healthcare, from the front lines to the filing cabinets. I was recently at a London university hospital and was inspired to do this podcast episode. I wasn't a patient, but it did make me wonder how artificial intelligence is reshaping healthcare and what are some of the pros and cons. Let's start with the part of healthcare that often comes with life-altering decisions: diagnostics. Imagine this: an AI looking at your X-ray, your CT scan, even your genome, and catching something your doctor missed. Not because the doctors weren't trained, but because they're human. They are under stress and are prone to errors. AI is already assisting doctors in spotting early cancers, tiny fractures, and genetic disorders with speed and accuracy. Google Health and Google DeepMind have built models that outperform radiologists at detecting breast cancer. Google's AI system, when tested on over 25,000 mammograms in the UK, achieved a similar or better performance than the traditional double reading system used in the NHS breast screening program. Radiologists' workload was reduced by 88%. But the point isn't man versus machine. The magic happens when they work together. Human instincts plus machine precision. AI drug discovery is no longer an experiment. It's a full-scale transformation in how we understand biology and run clinical trials. And here's the wild part. AI isn't just helping cure disease, it's creating the cures. Take in silico medicine, for example. In under 18 months, they went from an algorithm to a lab-tested drug designed entirely by AI. No years of trial and error, no billions of dollars spent in research. In 2023, 21 AI-developed drugs entered phase 1 trials, with success rates way beyond the industry norm. And for those that don't know, phase 1 trials are studies to find the highest dose of the new treatment that can be given safely without causing severe side effects. In 2025, we're not far off from AI-simulated trials done entirely without physical labs or on living organisms. That means fewer animal tests, faster breakthroughs, and cheaper medicine. And what if your treatment knew you better than your own doctor? Well, this is the real future of AI-driven patient care, where healthcare AI tools can adapt minute by minute, not just appointment by appointment. And this is where it gets personal, literally. AI is powering the shift from average patient to your exact biology. It's matching treatments to your DNA, your lifestyle, your real-time vitals. Tempus, for example, is using AI to help oncologists create truly personalized cancer care plans. That means customized treatments and no more copy and paste type prescriptions. We've also got research on insulin pumps that adjust automatically based on your glucose trends, and wearables that pick up silent heart rhythms before you feel a thing, all powered by artificial intelligence. And here's another question for you. Can AI heal the broken system behind the medicine? This is where AI for clinicians and AI in hospital systems is doing what decades of red tape couldn't, making care more human by removing the admin. Doctors aren't burning out because of medicine, they're burning out because of admin tasks and shortage of staff. That's where AI is quietly making one of the biggest differences. Tools like Suki AI are turning voice notes into clinical records on the fly. No more typing out patient notes. AI is also assigning medical codes scheduling staff, flagging billing errors, and speeding up insurance claims by over 60%. Doctors using these AI tools are spending 65% less time on paperwork and almost 50% more time with their patients. So AI is not just saving money, it's giving medical staff their time and sanity back. And who's caring for you when nobody's watching? We're now in the age of AI medical devices and virtual nursing assistants, tools designed to care between appointments and not just during crises. Here's a thought. Who checks in on you after you leave the hospital or in the middle of the night when something feels off? Well, AI does. From virtual nurses to smart stethoscopes, care is moving out of the clinic and into your pocket. Echo, for example, makes AI-powered devices that can detect heart conditions just from a home checkup. So, what about data integrity? Why is data integrity of patient data so important when it's being used with AI? One small manipulation by a hacker in a drug interaction prediction could lead to catastrophic outcomes. A corrupted dataset could literally result in the wrong medication being developed, or worse, administered. And that's why securing healthcare data is absolutely vital, as we are really dealing with life and death decisions. And what about the next 5 years? How will that have an impact on healthcare? Well, here are some predictions from researchers and specialists in this field. They predict we'll see real-time treatments that don't just follow the protocol. They adapt on the fly, minute by minute, to how your body is actually responding. We'll likely see the rise of agentic AI. We've discussed this in episode 7. These systems won't just assist, they'll act with autonomy, learning from patient data, making suggestions, and in some cases, initiating action. Think of them as digital doctors that never sleep. And what about the administration tasks? It'll be fully automated. All the admin, the scheduling of staff, capacity planning is going to be offloaded so doctors can finally focus on caring for their patients. We should also expect a major regulatory shift as new legal definitions of accountability, explainability, and AI malpractice will emerge. And not only that, AI safety audits will become standard. But none of this works if we don't lock it down. Fortress-level data security will be non-negotiable. Patient privacy, algorithm transparency, and secure interoperability across hospitals and systems will be absolutely essential. And maybe the most critical shift of all, accountability. Because once machines start making life and death decisions, especially for your parents, your partner, your children, we can't afford ambiguity. We need clear responsibility, explainability, and safeguards built from the ground up. But look, let's not kid ourselves. There's going to be some risks here. Data misuse, bias baked into the system, and a legal system that isn't moving fast enough. Especially in healthcare, the smallest data breach could have the biggest consequences. A malicious tweak to an AI model's training data could alter a drug formula, reverse a diagnosis, or skew entire treatment protocols. So let's wrap this up. Here's what's clear to me. AI isn't just enhancing healthcare, it's beginning to redefine it. From real-time diagnostics to drug development, from patient monitoring to admin systems that finally make sense, AI is filling the cracks in a system that's been stretched for far too long. But with that power comes responsibility, not just for the developers, but for clinicians, regulators, and patients as well. We need to be able to ask the hard questions now about data, bias, transparency, and trust before the systems become too complex to question. Because at the heart of healthcare is a human being in need. I'm Spencer Scott. Thanks for listening to this episode of Quantum Logic. If you found it interesting, please share it with your colleagues and friends. Until next time, and as always, stay curious and stay human. Bye for now.